This presentation is over Parkinson's disease by Addison Baldwin, Molly Gilmore, Andrea Parker, and Leah Fitzgibbons. By the end of this presentation, you will all be able to define Parkinson's disease, analyze the relationship between caregiver and family member with Parkinson's, name and explain different medications and therapies associated with Parkinson's treatment, evaluate different forms of physical activity to delay symptoms of Parkinson's, and summarize and conclude all components related to Parkinson's disease treatment and experience. Did you know that Parkinson's disease is the second most commonly diagnosed neurodegenerative disease behind Alzheimer's? An individual may be affected by tremors or shaking of the arms, slower movement overall, muscle stiffness, and difficulty maintaining posture. There are different forms of Parkinson's, but according to Parkinson's News Today, the majority of individuals will be diagnosed with primary Parkinson's. While there is no one defined cause, this type of Parkinson's has a positive response to medications, whereas secondary Parkinson's does not. There are other important types to be aware of, but another important symptom that can present itself in all forms of Parkinson's is Parkinson's psychosis, which are hallucinations or delusions as a result of the individual's condition. The individual may also experience frequent cycles of depression and anxiety based on their diagnosis, onset, and experience with the disease. The role of the caregiver for those with Parkinson's is never going to be static. Their role is going to change from the diagnosis to the later stages of Parkinson's. Important things to consider when interacting with your loved one is that they are just as frustrated as you. Since Parkinson's typically has a later onset, they are aware of their independence and abilities before their diagnosis, so this process is just as scary and overwhelming for them. Maintain an open chain of communication about these varying emotions. This will help ease both of your anxieties and contribute to the strengthening of your relationship through the uncertainty of a diagnosis and experience. However, it is important to stay current on relevant topics and trends within the neurological field regarding Parkinson's, but also create time for yourself. You need to be able to care and maintain your health in order to most effectively provide for your loved one.
One of the most beneficial ways to help your family member or loved one is to help keep their minds and bodies active. This is the number one way to keep their symptoms at bay. A good way to slow the Parkinson's psychosis is by keeping the mind active. Anything from crossword puzzles, playing bingo, or reading will help activate the brain. Ways to keep their body physically active is by taking walks 2 or 3 times a week, joining a yoga or Pilates class, aerobics in a pool, or even non-impact boxing classes. Having an active lifestyle while living with Parkinson's will help slow the decline of their mobility, balance, or posture. Physical therapy, occupational therapy, and speech-language pathology are valuable options to help the individual with Parkinson's. These 3 options must be prescribed, so if you believe it would be beneficial to your loved one, please talk to their neurologist. Activity is important in everyone's life, but for people living with Parkinson's, it can affect their symptoms and life for the better.
The medications that are prescribed for Parkinson's play a big role in how the patient feels on a day-to-day basis. It also has an impact on how the disease will progress over time. Levodopa and carbidopa is one of the most commonly prescribed medicines for Parkinson's. This medicine plays a part in controlling different symptoms such as stiffness and slow movement. Levodopa and carbidopa help the brain with the production of dopamine. Dopamine is a chemical in the brain that is involved with movement. Patients with Parkinson's have trouble producing dopamine and therefore have trouble with their movement. Some patients with Parkinson's will experience the on-off effect while taking the medication. The on phase means that the medicine is working to decrease the symptoms of Parkinson's, while the off phase means that the medication is wearing off and the symptoms are becoming less controllable. Though this on and off effect could be a result from progression in the disease, it could also be because the patient is not taking the medication at the same time every day. Taking this medication at the same time every day is vital to promote a quality effect. It allows a consistent prevention of symptoms and keeps the blood levels accurate for testing. As the caretaker, it is extremely important to make sure the patient is taking their medication at the same time every day. A delay of even 5 minutes could have harmful effects. Here are some helpful tips for staying consistent. Set an alarm on your cell or other device to go off at the times the medication is supposed to be taken. Set the medicine out in a specific location so that you always know where it is, or keep the medication with you in your pocket so that you always have it with you.
Another treatment option for Parkinson's patients is the DBS or deep brain stimulator. The deep brain stimulator, according to Parkinson.org, is the most important therapeutic advancement since levodopa medication. In DBS surgery, one electrode is placed on either side of the brain in one of the important areas that controls movement. This electrode blocks the bad signals that the Parkinson's disease is sending to the body and causes a decrease in symptoms for patients. The electrodes are connected by a wire under the skin that connects to a computer that is surgically implanted in the upper left chest. Think of this like a pacemaker for the heart, but for the brain. Many people do not know about this treatment method. Your loved one may be a good candidate for this surgery if they've had Parkinson's symptoms for over 5 years, have on and off symptoms even if they take their medicine consistently, have dyskinesia, their Parkinson's symptoms interfere with important tasks of daily life, or they've tried many different combinations of medicine that doesn't seem to be working well enough. There are many resources on the internet that are really helpful for caregivers as well as for patients, and your neurologist is always a good resource to talk to for any questions.
Thank you.
Thank you.
Thank you!
Thank you!